You're watching Fox 43 News at 10.
We just feel like we should provide him with every opportunity that our other kids have. And in order to do that, we needed to begin researching everything that could give him the best outcomes.
A family in Cumberland County turns to stem cells to treat their 2-year-old son diagnosed with cerebral palsy. However, there is a problem with the treatment. Thanks for staying with us. I'm Rachel Yankunis.
And I'm Evan Forrester. The stem cell treatment for the disease has not been approved by the FDA. Fox 43's Chelsea Kerbler has the family story from Camp Hill.
The day he was born, when he wheeled him down the hall and he was only a pound, and I started to cry and I said, will he live? And he said, of course, he's only small.
He's only small are the words Lance's mom, Danielle, and father, Rob of Camp Hill, have lived by since the day he was born. Among several surgeries and complications along the way for the preemie born 3 months early, Lance has always been a fighter.
Lance fought so hard just to survive the beginning of life and to come home with us. And he is just so happy and loving and amazing.
About a year ago, Lance was diagnosed with cerebral palsy. Doctors telling his family he will never walk, talk, or take care of himself.
We just don't believe that. We don't.
Lance receives a lot of therapies, but his parents did not want to just stop there.
We both overwhelmingly feel that he never gave up. He never gave up on us. He never gave up on himself. So, you know, we owe it to him to give him the opportunity. I mean, it comes down to, it's that simple. He deserves the opportunity.
Danielle began researching stem cell therapies, even speaking to doctors in countries overseas where treatment with stem cells is more readily accessible than in the U.S. The FDA has approved stem cell treatments for some conditions, but not cerebral palsy. However, trials to determine the effectiveness of stem cells for the disease are underway.
Like I said, what we've seen is a small but real appearing improvement in motor function.
Dr. Charles Cox with University of Texas Health in Houston began a trial in 2013 on the safety and effectiveness of banked cord blood or bone marrow stem cells in children with cerebral palsy, and is now just wrapping up the results from that trial.
The overall results of this study depend upon if you're kind of a glass half full or half empty kind of person. It is not a compelling, miraculous result.
All right, well, you don't want that anymore. Want that?
Because stem cell treatment for cerebral palsy is still in trial phases, it's not approved treatment by the FDA. However, the Maxwells did find a doctor in Harrisburg willing to transfer stem cells from a full-term baby's umbilical cord to Lance. But since it is not FDA approved, we were not allowed to be there to show Lance receiving the stem cells.
Here we are, Lance. Are you ready?
The Maxwells are hopeful following this procedure, Lance may someday walk, and more importantly, be able to communicate with them.
He wants to be involved. You can tell he's trying to communicate. He just can't get over that hump. But we believe that the stem cells could be that bridge to make it move a little faster.
Danielle says it will take about 6 months to see if the stem cells will have any definitive benefits for Lance, but already says she's seeing progress. She sent us this video taken 5 days post stem cell transfer and says Lance has never been able to stand on his own before. Chelsea Kerbler, Fox 43 News.